Hey everybody, welcome back to What's for Dinner. I hope you're doing awesome tonight. It's been a few days since we've been on, and just so you know, Teresa is here today. She's over here doing some dishes really quick. But in any case, if you're new here, welcome. We're excited to have you. I'm Mark. I'm a certified health coach, and this is Teresa over here. She's a board certified family nurse practitioner, and we like to talk about hormones and metabolic health.
I do. I love that.
So yes, we do. So anyway, tonight the theme or the title is going to be ketogenic diet and migraines. Ketogenic diet and migraines. So we'll talk a little bit about that here in a few minutes. But before we do that, I want to show you what we're having for dinner tonight. All right, so starting off with some scrambled eggs over here. Teresa likes to add cheese to those, and she cooks them in butter. So plenty of fat, plenty of protein. And then, Teresa, did you want to talk a little bit about your little pizza that you do down here?
Yeah, this is just a like a keto bowl. So you just put a little bit of marinara sauce at the bottom, very thin layer, and then mozzarella and pepperoni, and then I use Rosette's Everything Bagel seasoning.
Yep. And
so you guys just bake it for on 400 for however long.
Yeah, and we try and we use Rao's tomato sauce, because it tends to be a little bit on the lower sugar side. You might have some, favorite or whatever that you like to use, spaghetti sauce, but just be careful of the sugars, because they can sneak a lot of sugar in some of those, like ragu and whatnot. So these burgers here are you can see the fat at the bottom of that pan. So we typically order 70-30, so 70% protein, 30% fat, but I think these came out more like 60-40 this time around. The butcher who did this for us mentioned, he's like, we have a lot of fat in this one here, so it might be a little bit heavier on the fat side. I was like, brother, you can't put enough fat in there for us, so it'll be good either way. And then Teresa likes American cheese on hers, and then I got some mild sliced cheddar on mine. And then over here we have some of Rosette's dough mix, and she made bagels with those. We made these yesterday.
And I created drama in my title, and I said that there's going to be a fight over these leftovers, and who will win.
Yeah.
Who will win?
I don't know. Who's going to win?
Someone's getting 2, and someone's getting 1.5.
I'm pretty sure you'll get your way. All right. So moving on from that. So yeah, if you guys like that, I'll put the place where you can order rosettesmix.com. I'll put that in the descriptions and the comment sections.
Yeah, you're too late for Thanksgiving, but do it for Christmas.
Yeah, for sure. And then back here, we've got some of our, I like the Jane's Crazy Mixed Up Salt. Teresa likes the Redmond's Real Salt. And then we have more of Rosette's. That's her Everything Bagel mix down there on the left. So, all right, I think we got what's for dinner covered.
Yep.
So again, tonight we're going to talk about a little bit about the ketogenic diet and migraines. And so we already know that basically the ketogenic diet can help with a lot of stuff. All right, so we talk about it all the time. Just as a little recap, some of the things that it helps with are high blood pressure. If you have lipids that are off, so your cholesterol, triglycerides, your HDL, things like that, there's ways Teresa likes to look at those. So if those are off, it helps with fat loss, obviously, even though that's just a side benefit of it. And then insulin resistance, diabetes, that kind of stuff, PCOS, cancer, and much, much more. But we haven't really talked a whole lot about migraines. And then for those of you who don't know, which you don't, Teresa actually was in migraine medicine for many years before she ever found hormones or
that's my first life.
Yeah, the metabolic health side of things. As a nurse practitioner, she worked for a doctor in neurology, and that's all you did for many years.
Yep. I just wanted to say I saw a patient today whose mom was just diagnosed with cirrhosis of the liver and kidney disease from diabetes. So if you can get diabetes under control with low carb and reverse your fatty liver, then it doesn't turn into cirrhosis. And then another new patient I had was starting to ask me about her kids that she brought, 8 and 11. And I was like, I'm going to stop you right there. Whatever you ask me, keto will help. So it helps so many things.
Yeah.
But, all of us are born, we all could have the potential to get headaches, but all of us are born with a different threshold. And things like, wine and stress and weather changes, your period for females, all of those things can stack. They're stackable triggers. And then eventually you get over your threshold and you get a headache. Some people never get a migraine, and you should be glad.
Yes, be so glad. They suck.
Yeah, we both get migraines. I never started with migraines until pregnancy, but they're very few and far between now. But stress is another big one, inflammation, all that stuff. So there are studies showing that ketones, which if you don't have carbs or sugar readily available in your bloodstream, you're going to make ketones. You're going to be in nutritional ketosis, and the brain and the heart do prefer to live off of ketones. We just don't give them that opportunity because we eat so many carbohydrates. There's always sugar circulating in our bloodstream. But ketones can help, according to a study at UCLA, that it can help with migraine management. I don't want to forget to say there's a cardiologist, interventional cardiologist in our space, Christian Assad, and he does low carb because it takes his migraines completely away. Can you imagine getting ready to put a catheter in someone's groin or wrist to go look at heart vessels and put stents in there if you have a throbbing migraine with light sensitivity and stuff? Terrible. So also the ketogenic diet was originally noted for epilepsy patients with seizures in the early 1900s. One could say that seizures, a brain disorder, is closely related to migraines, an inflammation of the brain disorder, closely related to schizophrenia, bipolar, anxiety, depression, which is metabolic disorders of the brain as well.
Yeah, I thought it was really interesting when I was reading over that article. I just skimmed it, but I found that part specifically about how many of the mechanisms of epilepsy and epileptic seizures are very similar, or they have the same mechanisms in migraines. So that's why they're surmising that ketogenic diet obviously helps a lot with epileptic seizures, and that's probably the reason why it works with migraines as well.
And the way we used to treat migraines when I used to do this was with Topamax or Depakote, which are both anti-seizure medications.
Yes.
Those are the maintenance ones that will help drop your migraine frequency.
Yep.
So obviously stress can trigger migraines. And what do we do immediately when we're stressed? We go to comfort food and we start eating grilled cheese and fries. Like I never ate chocolate cake and stuff. I would go to grilled cheese and fries or pizza or something like that.
Yeah, alcohol, wine, stuff like that.
So I did not know this, but someone is surmising that there's evidence that right before a migraine, our cells become insulin resistant.
Yeah, that was super cool how they'd explain that.
Metabolic dysfunction, schizophrenia, migraines, all of these things can be tied in.
Do you want to just really quickly talk about insulin resistance with people, what it really is and why it pertains to that?
Yeah, so insulin resistant is when your body cannot utilize insulin because there's too much stuff going on. There's too much in your bloodstream. Insulin's job is to push glucose into the muscles and the cells. So when you have too much of it, your body starts to ignore it. You know, like when your wife tells you to take the garbage out and by the 10th time you don't hear her anymore?
Yeah. Oh, it doesn't take me 10 times.
That's not you. You take the garbage right out, but your personality is A. But, that's the kind of thing. If you hear something over and over, a little nagging, you forget about it. So that's exactly what's happening to insulin. You want to be insulin sensitive.
Yeah.
Okay, not resistant. So I was just thinking of a patient today, but I'm going to do her case study next time. There's several small case reports on people who suffer from migraines doing better on low carb. There's a somewhat larger study with 96 participants that followed low carb versus standard American, and the ketogenic diet was more effective at bringing about the reduction in the migraines. That's what you want. I mean, most of my time in neurology was women and migraine, but they couldn't think, oh, they got it. I just remember this so well. Someone got an invitation for a wedding, 9 months away. And she's just like, I don't know if I can go. Like I'm going to RSVP, but when the date comes, I might be in bed and not be able to do anything that day.
Yeah, it's sad.
It interferes with life.
Yeah.
And you could go on a medicine, but the medicines are synthetic and then they cause other things to happen.
I think a lot of people too with the migraine thing, because we've found this with a few people, even buddies of mine who I were like in the military when you were doing this migraine stuff, is that it doesn't present as a headache in a lot of people.
Oh yeah, sure.
So that's a big deal for a lot of people that don't know, because there's a lot of you, probably people watching right now who suffer from migraines, but don't know that they have a migraine because they don't actually get a headache. So that's me. I'm super light sensitive. So what'll happen is like when I used to travel for work, I'd go overseas and I would go from 12 hours on a dark airplane to all of a sudden I'm getting off in the desert and I'm opening, the airplane's opening up and there I am. And I would get like that evening, I would get to the point where I was just vomiting. I would just curl up in a ball on the ground and just be constantly running to the restroom and throwing up.
Yep.
And that was it. There was no headache. There was no nothing. I just felt terrible and was vomiting. And it turned out to be migraine. Yeah. So you just got to be careful with that.
Yeah, I worked with a nurse one time, and every time I walked in, and finally I was like, what are you taking? She would have this handful of things. She said, I'm taking Sudafed, Aleve, and I think Claritin. And she said, I have sinus issues. I'm like, I asked her a few questions, and I was like, those are migraines. So sometimes they present as sinuses, and you can even get runny nose and runny eyes. It can present as where your eye even constricts down. You can get teeth pain. I had a patient who had like 3 teeth pulled before I said, these are migraines. And so it comes across the ear and branches into the eye and the temple and the nose to cause sinus symptoms, and then in the jaw to cause severe tooth pain.
That was one of my buddies. Was that him we were talking about?
No.
So yeah, they were ready to take his sinuses out. They were pulling teeth. They were doing all kinds of stuff. And he was like, I don't know what to do. Like I can't, nothing they do is, and if they had done that, he still would have been in pain. It wouldn't have fixed the problem. And he would have had all those teeth pulled and his sinuses removed. We gave him I think we gave him a Topamax. And he tried Topamax.
Gave him a Maxalt or something.
Maxalt, that's what it was. But we gave him a migraine medication,
yeah.
and it fixed it right away. And he'd been years dealing with that. And so anyway,
yeah,
it's just wild.
And there are great abortive medicines for migraines like Imitrex, Maxalt, Relpax, Axert, those kinds of things. And those are okay. If you have a migraine, that is okay to take because they are debilitating for a lot of people.
Yeah.
However, you don't want to be having migraines so often that you have to do that 2 or 3 or 4 times a week.
Yeah.
You do not want headaches even monthly. So, yeah.
Get to the root cause and fix it. Yeah. Instead. Yep.
So, yeah. But that's about it. I got one when the first one I ever got was I was pregnant but didn't know it yet. I woke Mark up in the middle of the night. We were visiting friends in Savannah and I was like, felt like I was laying on rocks. And he's like, well, what do you want? And I was like, I don't know. And he said, you do this for a living. Just tell me what to get you. So I went and got Aleve, I think. But ever since then, it's been very sporadic. But hormones can definitely play a role in migraines, especially menstrual migraines.
Yeah, I was just going to say menstrual migraines.
Yep.
That's a big deal.
And that's a progesterone issue. When you get menstrual migraines, your progesterone falls, you have a period. So it's always a progesterone issue.
Wow. I'm so glad we're doing this because I can guarantee somebody who's going to watch this is going to go, holy cow, like that's me to a T. And they're going to go and get headache medicine. They're going to be fine. And they're going to start, if they haven't already, they're going to start eating better.
Yeah. And
it's going to help.
When I started doing what I'm doing now, I had to reconcile with people that I treated wrongly. There was this one woman who had severe menstrual migraines and all she knew was progesterone, but I didn't know that at the time. I didn't even know food mattered. I didn't even really know magnesium mattered. So you know what you know when you know it, but before then.
Well, we're glad you're here now, knowing what you know. Anyway.
Yeah.
What else? Anything else?
I think that's it.
Okay, cool. Well, we're at 12 and a half minutes. So,
okay.
All right, guys, as always, if you haven't already done so, please like us on Facebook and or subscribe to us on YouTube if you're on YouTube. And if you guys can leave us any kind of comments, suggestions, anything you got, all that helps with the YouTube and Facebook algorithm. Yes. So please do that. Stars and emojis are always appreciated. And then as far as all the information we talk about, all the stuff like Rosette's baked goods, or I'm sorry, her mix, she changed the name. Some of that, our website, our social media, all that kind of stuff. We'll drop that in the links in the description area so you guys can find that if you need it. Okay. Otherwise, just remember, food matters, everybody.
Food matters.
It does. And we love you all.
So much.
Yep, God bless you. And we'll see you next time.
Bye.
Bye.